Thank you so much, Mr. Chairman and Ranking Member and Secretary Becerra. Welcome. It's always good to see you. Appreciate all the work you're doing, you and your department, and I really appreciate the critical investments to expand healthcare access and affordability for communities, for families across the nation that's proposed in the President's budget. And this really does build on the investments and the work that we have done as Democrats with the President in the last 3 years. I do want to say, Mr. Chairman, I want to correct one thing. You were talking about, yes, that former President Trump didn't do anything on prescription drugs. What I would say, he didn't do anything for people on prescription drugs. But President Trump and Republican colleagues did give a 40% tax cut to Big Pharma.
You got it.
In their 40% tax cut did not translate to a 40% reduction in prices for the seniors in Michigan or for anybody on medication in Michigan. So we have been focused, working with the President and with you, on cutting prescription drug costs for Americans who have been paying the highest prices in the world, even though we have major investments we do as taxpayers to support the development of these new drugs. So the bills that we have been working on together have delivered lower costs, as we know, improved access, and transformed the way we provide behavioral health care in this country, which is so important and, as you know, is something I care deeply about. We have over 21 million people now receiving health care through the Affordable Care Act. That's a record, right? Over 21 million people signed up for insurance, very, very affordable insurance, and that's including 418,000 Michiganders, many getting a good policy for $10 a month, $20 a month. I mean, it's transformed families' lives to be able to have that health care. The health care premiums have gone down hundreds of dollars for the 271,000 Michigan residents who are using the Affordable Care Act, and of course, the $35 cap on insulin is lowering out-of-pocket costs for seniors in Michigan and across the country, not counting the inflation caps on cancer drugs that are used in doctors' offices or hospitals, not counting the cap this year on out-of-pocket costs, or next year when it goes to a permanent $2,000. And so there's a lot of, it's a big deal. It's a big deal, what we have been doing. So I want to just ask you a question and speak to what I like to call healthcare above the neck, because we need to make sure healthcare above the neck is the same as healthcare below the neck for people. And we've made historic investments in mental health, behavioral health, in a bipartisan basis. It's been really terrific to see that happen. I appreciate partnering with you and with the President to lower costs and create more access, as you have talked about. But particularly in this budget, the President including significant investments in the future of community care, which is certified community behavioral health clinics, where we are funding through the healthcare system, not through grants that stop and start. And as you know, this is something that keeps people out of the hospital, out of the jail unnecessarily, people off the streets that have been homeless, and gets them the care that they need. So we expanded CCBHCs nationwide through the Bipartisan Safer Communities Act. States are stepping up to participate. We have more states this spring that will be coming into the full program. I know that the budget not only supports CCBHC's expansion, but making it permanent. And I also want to give a shout out to Senator Cornyn. Thank you, being my partner in moving forward the definitions on CCBHCs to make sure they're permanently a part of Medicare and Medicaid. So this program is permanent. And so thank you for partnering on that. Can you elaborate on your plans to make this a permanent foundation for how we provide behavioral health care in communities across our country?
Senator, first to you and Senator Cornyn, thank you for putting in place something that has proven to be a great success and that now everyone wants to do, because mental health conditions don't surface between 9 to 5. They occur at any hour, any part of the day, and you have to be ready. And what you all did in making certified community behavioral health centers available, critical care centers available 24/7, was a God-saving measure for so many people. And so we're going to try to encourage other states to buy in, because the more we have these centers, the quicker we cut the cost of care for taxpayers, because at the end of the day, many of these folks end up using the emergency room to get the care that they need. And so what you have done is, by establishing these centers that are specific for them, for mental health conditions, it gives them a chance to see professionals that could treat them right away. And so we're going to build on that. The president's budget commits to that. And thank God you all came together on a bipartisan basis to address what 9 in 10 Americans say is a growing mental health crisis in this country.
Thank you. Thank you, Mr. Chairman.